Good evening, everyone. I hope that everyone is enjoying their National Heroes Holiday Weekend. Thank you for joining this Facebook Live conversation this Saturday afternoon in June. It's good that the weather's warmed up. It's been a little bit chilly in June lately. So I just want to get right into it. And the first thing I'll do is I will give breaking news and give the latest test results. And today, the Ministry of Health received 143 test results that came in, and 2 of these test results were positive for COVID-19. 2 out of the 143. And this means that the total number of cases in Bermuda is now 144. 144, and 8 are active cases, 7 of which are in isolation and recovering at home. I should turn off my phone. And in isolation and recovering at home. And the other 1 person is in the hospital in non-critical condition. A total of 127 persons have recovered, and the number of persons who have succumbed to this illness on our shores still remains at 9. Out of the 3 recent cases, 1 which was announced yesterday and 2 which were announced today, 2 are under investigation and 1 was a close contact of a confirmed case. Of particular importance, I think, for persons who would have tuned into the press conference on Thursday and would have noticed my concern when persons had said, you know, our case numbers are low, and do you think that we've turned the corner? I was very clear in saying that I actually do not believe that we have. This is from 2 factors. Number 1, even though that we had the capacity to test a significant amount of persons, there were not that many persons that were going to Southside to get tested. And so we changed our strategy and we are going to various locations throughout the island. I would say that the response to the testing on the road has been overwhelming. I want to thank Mr. Dean Paris, who is the project manager for the Ministry of Health, for organizing this, Dr. Armstrong at the Ministry of Health for spearheading this particular initiative, and certainly Dr. Parika Weldon at the Molecular Diagnostics Lab for assisting in making sure that we're able to run and return these samples. The key point is that as more and more persons get tested, that we're going to expect more and more positives. And I've been very clear in saying that COVID is still on our shores. And if we are not careful, we can see that there will be an increase of cases. And the last thing we want to do is to go backwards. That is why it is critically important that persons continue to practice social distancing, and most important, wear your mask when you are in close proximity to other persons. If you're in a close contact, it's something that's important and something I should actually go into. Close contact is if you are within a close proximity to someone, which is defined as 6 feet, certainly if you're not wearing a mask, for a period of over 15 minutes. So that can mean in a house, that can mean in a close outdoor backyard setting, that can mean a number of things, because if your respiratory droplets are going close to that person and you are an asymptomatic carrier of the virus, you can transmit the virus. And that's why it's important for us to continue to maintain our social distance, keep our masking, and make sure that we are not engaging with multiple persons at the same time. I think it is important, and these are not figures which are typically given, but out of the last 3 cases, 2 of the persons will be classified as young persons. And this means that persons are finding themselves in spaces and areas where they are probably not being as careful as they need to be. And these are the cases which are under investigation. This is important because as much, I would say, messages which have come into my social media, persons who are asking me as to why can't we do raft ups? Why are there so many restrictions, et cetera? And the statements of which I continue to give are, we still have a particular challenge with COVID on our shores, and we are far from being out of the woods. And I think that persons can see that in the United States, where they have been very lax on their mask wearing, that they are now beginning to see a resurgence in cases. Whereas if you look to Asia or Europe, where mask wearing is very strict, you can see that they have not had that similar resurgence in cases as has been seen in the United States. And so we don't want to be the example of the United States. We want to be an example of Bermuda, a country that can manage this virus well, has a population which recognizes the risks and avoids risky interactions and continues to go about their day and make sure that our economy can continue to recover while we keep our country safe from this particular virus. So I think that that's particularly important. And I hope that for the persons who are young, who are watching, or those family members of young persons, please continue to remind them that it is particularly important that you have to keep on wearing your mask and observing social distance, because the coronavirus is still on our shores and will not be eradicated from our shores until there is sufficient amount of persons who are immune to the virus, so it does not start spreading either by vaccination or having gotten the virus and recovered from the virus, if it does confer long-term immunity, which is something which still needs to be discussed. On that, before I get into the questions, of which there's been a number which have been submitted, I would like to say that on the whole, I think that Bermuda has done a reasonably good job. I think that there has been some persons who are becoming a little bit more lax, and I think that it's very important that we don't do that. I'm pleased that businesses in Hamilton, businesses throughout the country, I would say, restaurants and other establishments which are opening are holding very firm to the requirement of persons to make sure they continue to wear their mask indoors. That will certainly reduce transmission. And for persons who are outside in different places, please recognize and understand that the virus is still on our shores. And though we had a decline in the amount of persons who were positive for a time, as we test more and more persons, and as we are now in phase 3, with additional interactions which came from phase 2, we can expect more positive cases. The lockdown, as it were, and the staged approach was to make sure that we had time to scale up our testing, our other types of infrastructure and things which we can do in order to continue to manage this virus. And I think it's critically important that we all do the work which is necessary to restrict the transmission. Now, there's a number of questions I know that people wanted to ask regarding the airport and the reopening of our borders to tourists. The first thing I would say is that persons have expressed alarm, especially when speaking about travel from the United States and possibly even the United Kingdom and the virus situation that exists there. I think that it's particularly important that we recognize that because the airport will be open to regularly scheduled commercial traffic, does not mean that we're going to have 8 planes that are going to be landing on July 1st a day. That is not the case. We needed to make sure we gave as advance notice as possible to our airline partners. At this point in time, we are not expecting, I think American Airlines has not anticipated to resume its schedule until August. Delta will possibly resume services in July. JetBlue will not be resuming services until August. Air Canada will be resuming services in July, and also WestJet will be resuming services in July as well. And I think British Airways is set to resume services in July. So I don't want people to think that the airport is going to be overrun, but we are going to have a strict regime for visitors coming into our shores. And this does mean that we're not going to have as many visitors as would normally come. That is a bad thing for our tourism sector, certainly, but it is what's necessary in order to keep our country safe. So what we've asked is for persons to make sure that they have a test within 72 hours before they board the plane. And why is this important? This is important because if someone gets on a plane and is tested on arrival and has the coronavirus, then that person cannot actually leave the country because the airlines will not board people who are known to be positive for this particular virus, and that will be a challenge. So that's the first instance, and we want to prevent persons who may have the virus from getting on a plane. So they're certainly importing it. Now, there's been a few questions of which have been asked about what happens if you're going to require a test be done within 72 hours, but in the jurisdiction where I'm coming from, I can't get that test in 72 hours. What do I do? How do I go about that? The Bermuda Tourism Authority is going to be working on that particular issue and will be identifying places where the government of Bermuda will work with them to make sure in our gateway cities, which will be open for flights, which will be Toronto, Boston, New York, and Atlanta, and also the United Kingdom, to make sure that we can have that testing capability for persons who wish to board flights to Bermuda. The second level of protection will be testing at the airport. And there was a little bit of confusion or discussion about the language which said testing at the airport or either testing at the hotel. The anticipated testing is going to be at the airport, and it would only be on special occasions or in other special circumstances that the testing may not be at the airport. But what we are intending on doing and rolling out is for all persons who land to be tested at the airport. And given that we're not expecting incredible volumes, we believe that we'll be able to handle that testing at the airport. What will happen when persons are tested at the airport? Persons will go to their hotel, and until they are given a positive or negative result, hopefully a negative result certainly, they'll be asked to quarantine on their property, not to go out, not to expose persons, and to do that level so we can ensure that it is safe to travel. Now, in 3 weeks, when the airport opens, we are expecting that we will be able to not only have the nasal pharyngeal swab, which is what we see, which can be rather discomforting for persons who get it. It's not that bad, and I encourage persons to make sure you go get tested. But we will also hopefully have the saliva test as well, which it requires nothing more than persons being able to get an oral swab. I think Dr. Weldon said some of them is spit, some of them is where you rub something on the side of your mouth and put it inside of the same collection kit. But we're looking at making sure that we can have that solution implemented as well. Persons are asking why we're going to require persons to be tested on a regular basis. And this is just a very simple thing. We haven't fully set that much in stone yet. It is the recommendation of our health professionals that we engage in regular testing of persons who may be carrying imported cases into Bermuda. And so what we set that is right now at a tentative basis is every 72 hours. And that means that persons may come home, they just go ahead, spit in a cup or spit in the collection thing. And then we will go ahead and have that. The lab will run it, and the next morning they'll be able to see their particular or individual test results. And if, of course, it's positive, then that'll be a challenge. But we're expecting, if persons are doing what they should be doing, making sure they remain masked, practicing good hand hygiene, that we're not expecting that there will be those positive cases. But we want to ensure that we keep our biosphere, as Minister Keynes always calls it, we keep our biosphere healthy and clean. There's been another bunch of questions which have come in regarding personal services and the expansion of personal services, et cetera. And on Thursday, I announced that we will be doing a phase 3B, but part of this phase 3B will, in the expansion of personal services, where persons will be engaged in higher risk activities, such as facial services, beard trimming, all the rest, we're in close contact with someone and their face, that we're going to require operators who engage in those particular services to be tested on a regular basis. And this is just for the protection of the country. And I'm certain that operators can understand that. Persons who would like to avail themselves of those services certainly would understand that they want to make sure that they are safe. Clearly, contraction of the coronavirus, though in most cases, the symptoms are very mild and persons don't even have symptoms, and most persons do recover. We do understand that you could spread it, you could unwittingly spread it to your members of your family, et cetera. So in any cases where it's going to require the mask to be removed and we're going to be up close and personal with persons, that we're going to require that enhanced testing or regular testing regime take place. So the Ministry of Health has finalized the details on that, and I think that is something that is necessary and important to protect the persons in this country so we can keep transmission to a minimum. So what I would say is, for those persons like myself who want to make sure that their beard gets shaved, or eyebrows or other type of things of which they wish to engage in, to encourage your operator to make sure they avail themselves to the testing which is taking place. And that will lead me to our updated website, coronavirus.gov.pm, where you can go on it, and it has the links there for the COVID testing. So you can go ahead and you can book an appointment, at the multiple testing sites which will be taking place throughout the country. The schedule of testing is also on that particular website as well. What I would say is that there's been some long lines at these testing sites, which is great, which is actually great. And I'm so pleased that so many Bermudians want to get tested now that we have brought the testing to persons. I would encourage people to, of course, go online and to book an appointment. If you book an appointment, your line will not be that long, but please go ahead and make sure you take advantage of the free testing, which is going to be offered. Additionally, we're expecting our shipment of antibody tests to be on island next week. Unfortunately, there was a slight delay in shipment, and so we're expecting it to be on island next week, and that will be given in conjunction with the testing, which is going throughout the island. And so, as I said, that is continuing, and that is something that I want to encourage persons to become engaged in. Now, I'm certainly going to start looking at the questions which have been sent in. And we have a team here from the wonderful team at the Department of Communications who have been doing such an excellent job in making sure that the public remains informed of the latest goings on of the virus. And we want to make sure that we go ahead and continue to keep people informed. All right, so the first questions I see are questions which are specific to travel. So I did, I think, answer a lot of those particular questions. There's a question of who pays for the tests upon arrival. We are working through those particular issues. I do not want to charge people an excessive amount for testing. Clearly, Bermuda is not the cheapest jurisdiction to travel to, and I don't want to put additional prices on to suppress demand even further. But there will be some cost recovery. We're looking at doing something which is more reflective of what we see in some of our competing jurisdictions, and that price will be confirmed shortly. But it is not going to be something that is going to be onerous. I don't want to add another price for the flight of a plane ticket on top of a flight to Bermuda as well. So we're going to make sure that we keep that to a minimum. Certainly, persons who are flying to our island, staying in our hotels, are certainly putting money in our economy. And I don't want to distract that by adding additional costs onto that particular figure. There's a question about what about residents returning once the airport opens? Will they be subject to the testing mentioned for tourists? The answer to that question is yes. Persons who are residents who are returning from overseas are not necessarily required to get the 72-hour test in advance while you're traveling. But when you're here, you will be tested at the airport. If you're positive, you will be placed on quarantine. If you're negative, you will be required to do a retesting regime just to make sure you don't develop symptoms, to make sure that we keep the biosphere safe. So absolutely, that is going to be a requirement for persons who are returning to the island, because we want to make sure that, given that there is so much asymptomatic transmission, that if you manage to contract this virus, we want to make sure that we know who has it and to make sure that you keep your family safe and also yourself safe. So certainly the quarantine requirements will certainly apply prior to getting your results, and we're going to make sure that persons are subject to a regular test regime, as that is something that is particularly important. The one thing is that we don't want to have a different set of rules for residents and for tourists, so we're trying to make sure we harmonize the rules so they work in all instances of persons who are arriving to the country. I see still a lot of questions, certainly about testing, I think are for visitors coming. So I think I've managed to explain a lot of those particular questions. Is there an update on Bermuda to London flights? Regarding Bermuda to London flights, as I said, I think British Airways is looking at resuming the service, and those flights are expected, I think it was 2 or 3 times a week. Also, a lot of the airlines who were having daily service or twice daily service, example would be, I think, JetBlue, which has 2 times daily service out of New York's JFK Airport, will be doing a service, I think, 2 or 3 times a week, and clearly only one day. So in addition to there being less planes which are flying to Bermuda, I think that Newark Continental has canceled their service for the entire year 2020 out of Newark, United, not Continental. The Miami flight from American Airlines is not expected to resume until very late. So there's a number of, I would say there's a number of flights. Will be certainly a lot less flights than we had before. There's a question from Ms. Spencer about why still 8 p.m. for beaches. 8 p.m. for beaches is only for the particular weekend, for a holiday weekend. And that is just from a plain and simple perspective. We know when it's a holiday weekend, we know that more persons are out. And the fact is, when we're in these situations, we're relaxing, a little alcohol, a little bit of fun, all the rest, we let our guard down. And those can be times for spread. And I want to make sure that I'm very clear with everyone who is watching. The coronavirus is still on our shores and is still circulating inside of our community. That is the key point. And the government's responsibility is to minimize the opportunity for the transmission of this virus, to ensure that we do not have a situation where we have multiple persons inside of the hospital. We went up to 16 persons inside the hospital, which presenting with difficulties and symptoms, and then having to roll back some of the restrictions or some of the loosening of the restrictions of which we've had. And those are things which are now being contemplated inside the United States. And that is not something that we want here. So I ask for patience for the public, because it is very difficult balancing the two competing interests of the need and want and desire for everyone to be free and to party and to relax and have a good time versus the real risk that we have that we could end up like other countries who have relaxed, or other jurisdictions in the United States who have relaxed and are now seeing a significant increase in cases, which is not just due to increased testing, but also due to increased transmission. But that is only for the weekend. Apart from that, or the holiday weekend, apart from that, the regular restrictions do apply. And I think that it's curfew hours. And I think that Minister Birch, who is the minister responsible for parks, has been very clear on this. There's a question that says, will retail stores be able to increase capacity for in-person shopping in phase 3? I know that is something that has been considered by the Cabinet Committee for the reopening of the economy, which is chaired by Colonel Birch. And that is something that may be communicated. I'm not entirely certain. I do have the full printout of the social distancing and closure schedule. So I'll go ahead and take a look at that. And I will see whether or not there is any particular change on there, which states insofar as the retail shopping. These are things that I used to be able to answer off the top of my head, but now that this has been delegated to the Cabinet Committee, I'm not able to answer the questions as well as I used to. But if I'm looking on here and we're looking at retail establishments, banks, supermarkets, grocery stores, health services, here we are, retail services. It says, can open from 6 a.m. to 10 p.m. with physical distancing, all employees and customers wear a mask. And I think that has actually changed from the last time around. So I do believe that some of the restrictions have been lifted and or increased, but I'll make sure to give an actual confirmed answer, Ms. Furtado, on that. So I would say that as we are now in phase 3, it is far less restricted than we were in phase 2. In phase 1, persons were not allowed to enter retail establishments. In phase 2, persons are allowed to enter retail establishments, but it's a restricted amount of persons. And in phase 3, as we're looking on here, certainly as long as people are maintaining their physical distancing. I know there was a question about increased the capacity that possibly exists inside of grocery stores. That is something that the committee is going to examine. I know there's been a lot of commentary regarding the daily shopping, or sorry, the only place where we have restricted days of shopping at the grocery stores. And that is something which is certainly a difficult balance. And there's a lot of persons who believe that we should remove that restriction. The Cabinet Committee has certainly debated this particular issue. And they've come down on the side that for now, we're going to continue with it. And if we believe that that restriction can be released, then we'll go ahead and release that restriction. The fact is that right now the grocery stores are offering the discounts on Monday, Tuesday, and Wednesday. And what we do not want is for those discounts to only go to Wednesday and have large lines and a lot of persons that are in the grocery store at one time. So we're trying to balance all of those particular aspects and to make sure that given that grocery shopping is something that is particularly important for persons to engage in. One of those things, which is one of those mandatory things which you have to do. We want to ensure that we are not having a crush of persons, these very long lines, which we had when it was every other day of shopping, et cetera. So that's our intention there. But the Cabinet Committee will consider. I know the Deputy Premier has reached out to a number of the various grocery stores, and we're going to be able to provide further guidance on that. There's a whole lot of questions on travel. Here's a great question from Mary Margaret von Herstein. It says, will any consideration be given to those who carry high levels of antibodies in terms to quarantines and restrictions? This has been a question that I've asked the committee that advised me, made up of the top scientists inside of the government and also inside of the hospital, about what do antibody tests really mean, and can they be used as a way to reduce restrictions for persons who are traveling. The fact is that the science is not yet clear on this. So there's not going to be a doctor who is going to say, yes, if you have a high level of antibodies, you're not able to be reinfected. That is the case for most infectious diseases, and it's a high probability that that may be the case with novel coronavirus. The fact is, right now, we just don't know. And because we don't know, we are not going to have that factor into our travel decisions. However, if in the next 2 weeks that science changes, we will then go ahead and factor that into our travel decisions. And it is very likely by the time where more flights resume in the middle of July or in August, that those things may be more clear. At this point in time in June and early June, they are not clear. And so the government is not prepared to rely on that, as we could be presenting an additional risk to the economy. So that's certainly a great question. We want to be sure to use the antibody tests in a way that will certainly work. They're certainly a lot, I would say, less expensive to deliver, and can give a little bit more information or different information than the PCR test does. However, at this point in time, it is not enough to rely on the antibody testing or the serology to confer immunity, and therefore to reduce the restrictions on that. So that's a great question, and thank you for that. No, there is a whole lot of questions regarding travel. I'm looking at this sheet of paper, and there's many questions dealing with travel. I think I've answered a lot of those questions. There's one question from Yaniko Smith, and it says, residents returning home, can they quarantine at home for the 24 hours while waiting for results, or do they have to stay at a hotel? The answer to that question is at home. I do believe that the mandatory quarantine at hotel facility has completely wound down now, and we are now on self-quarantine. I can inform persons that the that we had for the home monitoring solution have arrived on island, and I know the Ministry of Health is working with the government's Information and Digital Technologies Department to work to get those things ready for deployment. But certainly there is not the requirement to quarantine at a hotel, and individuals will be able to quarantine at home prior to the receipts of those particular results. There's a question about the government reopening, not the government reopening, the airport reopening, and the announcement has been made for the airports reopen on July 1st. There's a question from Miss Carla Sanders Zool. Here you are, Carla. This is just for you. I have my Somerset 2009 Cup Match Cup. As I see that you've been making a little bit of fun of me on my social media regarding the cancellation of Cup Match, which has certainly upset me to the core. As most people know, that is my absolute favorite holiday. But I will want to let people know that this is the first time that we will be having Merry Prince Day on the second day of Cup Match. And I can assure you that the government will ensure that that particular holiday following after Emancipation Day is properly and rightfully recognized. Though we are not going to witness a cricket match this year, and though we are not going to witness or enjoy the festivities, which have been a historic celebration of the emancipation of Bermuda, we will certainly recognize our national hero, Miss Mary Prince, as the government has renamed the second day of the emancipation holiday Merry Prince Day. and we will certainly make sure that that is recognized appropriately. The question that Ms. Sewell had asked is regarding insurance. If Bermudians here in the UK have NHS and not private insurance, how are they to obtain insurance when you cannot buy a policy due to COVID? Thank you for that question, Carla. It's a question that has been posed by a number of persons, and I want to say the Ministry of Health and the Ministry of Tourism are looking into the various options that can be provided in that particular case and instance. Angel Azario says, why are we allowing untested people into the island? Yes, they were tested when they arrived. However, they were not tested prior to leaving other countries. Mr. and Mrs. Azario, you are not correct. We are requiring persons to test before they get on the plane and also testing upon arrival. So that is not correct, and we are not allowing untested people to enter the country. And so we are very jealously guarding our biosphere. And what we are doing is making sure that we balance the need to have additional economic activity while making sure that we keep the country safe. We've made massive investments in our testing capability on island, and I think that we should make sure that we use that investment of which we've made so that we can keep the country, keep our numbers low. But it is important to recognize that there will continue to be the coronavirus on our shores. The policy of the government of Bermuda is not the complete and total elimination of this virus from Bermuda. That is not going to be possible without us having kept the country closed and shelter in place for about 2 months while making sure that we completely snuff out the virus anywhere where it is. And then at that point in time, leaving our borders closed for no persons going in and no persons going out. That is unrealistic for an island, and that is not something we can do. So we will have to continue to live with this virus. And that's why it's important for persons to continue to maintain their vigilance. Question that was asked, is there any information regarding a cruise ship season? Right now, the US is not allowing cruise ships to sail. There have not been very many discussions on cruise ships, but I'm sure the Minister of Tourism and Transport will give an update in the future. However, the same things would apply for cruise ships as they will for the airport or any other person coming into a port of entry. They will need to be tested. They will need to be tested prior to arriving, tested prior to, I would say, disembarking, just as they would be tested getting off of a particular plane, cruise ship, and we will keep our biosphere safe in that particular manner. The question as well is, what is the process for visitors staying with residents, visiting family? Can people get tested multiple times? Yes, they will be required to be tested multiple times, and we will make sure that we take those particular things into account. I saw another question about what happens if they're staying at an Airbnb, et cetera, and we're going to make sure that happens. It is particularly and very, very important that we keep up that level of testing, because the incubation period of this virus can be anywhere from 5 to 14 days. And that means that someone could theoretically, test negative, but have contracted the virus at the airport. You never know. And if they contract the virus at the airport and that doesn't show until maybe 6 or 7 days later, and they're still here, we want to know that. And so that's why it's particularly important. And I would expect anyone who's staying with family or relatives certainly would want to make sure that persons who are traveling from overseas are safe as well, and would want to make sure that in this particular case, an incubation period, that they go ahead and get that regular testing done. But those are certainly details worked out, but I don't think that they'll be that difficult to work out. Of course, Bermuda is only 22 square miles, and so it's not as large as other countries where that could be a little bit more difficult. There's a question from Mr. Troy Butterfield, which says, when Bermudians are leaving to go overseas, will they have to pay for a COVID test, and what will be the cost also returning back to the island? Will Bermudians have to get tested again before returning home, and once home, will they have to quarantine? I think I've kind of covered that. Returning residents do not have to have a COVID test prior to coming to the island, because when they are here, they are at home. And so that's particularly important. However, and this is an important thing to note, that yes, you will require to take a test upon landing. And if you test positive, you will be required to go into isolation, and you will be required to have the same regular testing regimen. Questions all about flights. Here's something that is a different question that is not regarding flights. This is Miss Lisa James, and it says, Premier Burt, once we pass the 12 weeks of being on unemployment benefits and we apply for financial assistance, if we are granted our pension, will that disqualify applicants for receiving assistance from the government? Question number one. This was something that was hotly debated when we went through this particular issue. And the one thing is that we don't necessarily want to penalize persons who may have accessed their pension from accessing other types of benefits. I know that there is a rule that is going to take place to make sure that persons who are not on financial assistance, who have access to savings to their pension, aren't abusing that. So there's going to make sure that we get that fine balance. What is key and important to note is that the unemployment benefit has been extended for an additional month. So it is not just 12 weeks, it is 16 weeks that the unemployment benefit has been extended for. You will now note that the unemployment benefit was being administered through the Department of Workforce Development in conjunction with the Ministry of Finance. And it's important to note that the Minister of Labor now has responsibility for not only the Department of Workforce Development, but also the Department of Financial Assistance. And that is to make sure that the transition from one to the other can be as seamless as possible. So thank you for that particular question. It says, are you expecting suffering people to use the little bit of money they have from pensions to survive? Will you be allowing people to use the extra money for future, such as mining home, buying furniture, supporting children extra activities, paying off arrears, changing eating habits, healthy food, or they expect to use it, go broke, and then go to red tape for assistance? I accept the perspective of where the question is coming from, and I don't want persons to go through red tape for assistance. That is the particular reason why we are focused on making sure that we can open our economy as quickly as possible, get as many people back to work as safely as possible, while making sure that we have very strict controls regarding masking and otherwise. And I can just refer to the example of Taiwan, where masking is universal, a country that is very close to China, but has not necessarily had to restrict activities, particularly because they have universal masking and because people adhere to those particular rules. So that's what's particularly important here. I don't want to have people struggling. I don't want to have persons, I would say, trying to figure out how they're going to survive. And so that access to the pension savings is something that I want persons to use, but I certainly do not, we have to strike a very fine balance on that particular question. So I understand the perspective where you're coming from. The one thing is that the new Minister of Labor is acutely aware of the damage that can happen between the time of transition from one benefit to another, and certainly the challenges in which we're experiencing in our community in a number of places. And we're going to make sure that red tape is not there. The next question is, will the application process for financial assistance, I'm assuming, be as daunting as it is now? There certainly is a rigorous process which is necessary and required to ensure that persons are responsible for financial assistance, are able to receive financial assistance. There may be some streamlining of that process, such as not submitting the same information which you submitted for the unemployment benefit, but there is the need to make sure that the rules which apply to financial assistance are going to be the rules that have to continue to be followed. But we recognize that this is a different situation. I'm not going to go to the perspective of saying that people need to start selling their cars and selling their houses in order to get financial assistance. That's not it. And we need to strike that particular balance. I have confidence that the Minister of Labor will be able to strike that balance, and I'm certain that you'll be able to hear from him in the near future on the plans in which he has for the transition from the unemployment benefit for those persons who will need to over to financial assistance. There's a question here, a good question from Mr. Cy Witter. It says, good day, I read the updated guidance for gyms which stated 20 persons only inside a facility. Can clarification be given on this cap and how it adjusts with the square foot of the facility? Separation based on members of rooms and staff. How does this 20-person cap adjust? There are multiple rooms and the facility exceeds 2,000 square feet. Mr. Witter, if you can tell me the specific gym, I'm certain to try to get additional clarity on that particular question. I will say that I am concerned with gyms particularly. I'm certainly concerned with the fact that that is a place where there could certainly be a very large risk of transmission. And we're going to make sure that we get the requirements right on gyms. We do know that the guidance has said that masking is preferred inside of gyms, but if you're engaged in strenuous activity inside of a gym, that you should be masked. And I think that we might actually have to revisit that because given that droplet spread, and if you are engaged in a very physically exerting activity and you're in an enclosed space and you're actually breathing out a lot of respiratory droplets and you're an asymptomatic spreader, I think that could be a very dangerous situation. And I would say that if you were engaging in a strenuous activity such as running or something like that, it's probably better to engage in that activity outside and not in an enclosed space when there is so much risk of asymptomatic transmission. But we're going to look at those specifically. Right now, the limit is 20, I will tell you, Mr. Witter. We are running through a particular challenge insofar as making sure that we can be dynamic based upon the size of the particular establishment. And I'm sure as we go through the steps, that we might be able to provide additional clarity on that. But I appreciate your question. It is something that it's difficult when dealing with these things where it's not necessarily a one size fits all perspective. But I do recognize, I know that the Minister of National Security, who has responsibility for the fire service, who has responsibility for occupancy in places such as churches and others, we've tried to use the 20% occupancy figure to make sure that so it can be balanced based on the size of the establishment, but we're going to have to work on that a little bit more. So thank you very much for your question, Mr. Witter, on that. Do we have some more questions? Okay. The question says, when can specialist doctors return to Bermuda? I would say they can return to Bermuda when the airport reopens. And until then, given that they are not residents, they would not be allowed to return. So when the airports return, I would expect that specialist doctors will be able to return back to Bermuda. Of course, this is based on flight availability and others, and based upon what the Bermuda Hospitals Board will allow persons insofar as operating. But if they're visiting doctor's office, et cetera, I would strongly recommend that you engage in telemedicine at this point in time. But certainly once the borders reopen to persons who are not residents, then those persons should be able to visit the island and render the services of which they render here. I see a question which says, when will beach bathrooms be open? And I know that this is a particular question. I got a WhatsApp from one of my constituents. I'm sorry, I'm just looking for my phone because I'd sent Colonel Burt a message because I received a WhatsApp from one of my constituents who mentioned something about the beaches, the bathrooms in the beaches being closed. And the response was that they are open and closed at 8 p.m. That's what's supposed to happen. But the Minister of Public Works is going to confirm that. What I can say is if the Minister of Public Works says they're open and are supposed to close at 8 p.m., then the Minister of Public Works will ensure that we do what's necessary in order to make that happen. What I can say, however, is that there is not going to be someone from Public Works who's going to be guarding the bathrooms to make sure that people are practicing hand hygiene and social distancing, et cetera. So please make sure you do that yourself and don't allow that to be a place of possible virus spread. The question here is, will a spa be able to open in phase 3B? At this point in time, that is the intention. However, if persons, for instance, in spas, which are even more enclosed environments in some places, and persons are there for longer periods of time, it's certainly going to be a requirement of the operators to get tested. So if you are a spa operator and you want to go ahead and open your spa in phase 3B, I would strongly recommend you go to our website, coronavirus.gov.bm, and make a reservation for one of our testing sites so you can go ahead and get your coronavirus test as quickly as possible to enable you to provide the additional services such as waxing, massages, and facial and esthetician services. Is there an age limit for testing? I don't actually believe there is. I'm probably sure we won't test infants, but I need to try to get that confirmed. I do know that we will test younger persons because they can still test positive, but I wouldn't take a 3-month-old there certainly. But certainly I would say that We want to make sure that persons who get tested. I remember saying something about possibly would not be testing persons under the age of 10. I do need to clarify that, and hopefully the team, which is here with me, will be able to get an answer for that question. There's something here. When will the outpatient surgery be open? I know the Bermuda Hospitals Board is managing what they have at the hospital. I know that they have loosened some of the restrictions, and I would say that that is something that will probably start to resume quickly. One of the challenges, of course, is if you have a place where the hospital is locked down, where you do not have other services which are being rendered, you can actually negatively impact the health of the country in other things which are unrelated to COVID. In my conversations with the persons at the hospital, I am certain that they are aware and attuned to that fact, and they are working through how they're going to be able to open up the hospital for those particular instances. One of the things in which they're looking at doing is bringing in antigen testing. Antigen testing is a different type of testing, which is from PCR testing, and they're looking at investing in that type of solution, and I know that they're working on that. Hopefully they'll be able to get an antigen solution up and running in the hospital before the end of the month. And if they're able to do that, then that will precipitate the easier opening. But the last thing you want to do is to introduce possible asymptomatic cases inside the hospital and cause a spread amongst vulnerable populations. So the hospital is being very careful on that particular regards. I know that it's been very hard, especially persons who've had persons in the hospital who have been ill and not being able to see them. I've heard the stories of fathers who may not be able to be in the hospital during C-sections for the birth of their children due to the additional risks that the operating theater presents. And I know that this is certainly not the ideal circumstance, but it is very difficult having to balance the risk of possible exposure inside of a very sensitive space to the need of all individual persons who want to enjoy the freedoms of which they typically have enjoyed in the past. So I would say that the hospital is aware to that particular instance and is working on getting antigen testing up at the hospital to enable persons to be able to access those particular services. Will planes be bringing the post office and mail? The answer to that question is certainly yes. I do know that there's been a question of outside and external mail and arriving on island. I do not believe that external mail has been completely stopped. I do believe they may be using the cargo jet flight. I know that I've received some overseas mail. It was a little bit delayed, about 2 months, which is expected, but I did certainly receive it. But yes, the planes will be carrying mail, and the post office will certainly be working through the particular logistics, as some of our mail may be used to coming on certain flights, and we might have to put it to other flights in other jurisdictions. This is an excellent question here, and it says, will universal health care be a consideration going forward? Universal health care has been a consideration as government from the very start, and we were elected. Part of our platform was speaking about the introduction of the National Health Plan. I think that persons have seen that certainly in times of crisis, it is important to have access to quality and affordable healthcare that is able to be presented. We have taken the unprecedented decision of making sure that we are providing free testing to everyone in the country, which is not a burden to insurance companies, which is not something that's going to increase premiums, which is not something that is going to be a burden to individual citizens, et cetera. And I think that it is an example of how we can approach healthcare in a different way, in a different form, in a different fashion. And we're going to have to do a lot of things differently after this crisis. This crisis will have a significant impact on our economy. And we're going to have to determine whether or not we want to have a healthcare system where persons are only able to access that healthcare system if they have a job, recognizing the difficulties of which we're going to have in the near term, where we may be looking at extended hotel closures. And I think that's something that is particularly important to recognize. So when we look at our large hotels, specifically the Fairmont Southampton, the Hamilton Princess, very large hotels, those hotels require a significant amount of occupancy in order to be filled. And if we don't even have the air capacity flying to the island due to the fact that the airlift is not what it typically is in any given year, it may not make financial sense for those hotels to reopen, as they may lose more money opening than remaining closed. And this is something that is very real, that we have to be very attuned to. So the questions of which you ask about universal healthcare are important questions. And I think the country needs to continue that particular debate. The debate got sidetracked between patients first and these things, et cetera. But at the end of the day, the question of which we have to ask is, what is the best way to ensure that all of our citizens have access to quality and affordable healthcare? And I'm happy to continue that particular debate. But in a time when we are seeing how quickly our health circumstances can change, I think that it's important that everyone have access to healthcare. So I thank the person for the question about will universal healthcare be a consideration going forward? It absolutely is not just a consideration. It is something the Progressive Labor Party inside of its not only election manifesto, but also in our throne speeches has committed to and has advised things. And I would advise persons to go to certainly the website. I'm going to make sure that I have the right website for the Bermuda Health Plan. So you can go ahead and take a look and to see the things which are there and to give your feedback. And that website is healthplan.bm. So feel free to tune in to healthplan.bm. Okay, and the answer to the question about is there any restriction on the age of coronavirus testing? It is any age with a doctor's referral. If you're going to the particular walk-in station, certainly they will test you. If it's, I wouldn't recommend an infant or someone very young getting tested, but a doctor can certainly make a referral for a test for an infant or a young person if they have suspicion that they may be infected. A question says, will other restaurants be able to build outside like Hogpenny? And what is the rationale for that? The rationale is very simple, although it's kind of interesting because now restaurants are able to offer limited indoor seating and services. So it was kind of a moot point because I think it was anticipated that indoor restaurants would not be open until phase 4. The Hogpenny did not have any outside seating, I guess, and they went to the Corporation of Hamilton to see if space could be opened up and provided for. The Corporation of Hamilton, and working with them, did go through and look to provide that particular space. What I would say is the rationale for that is that we want to make sure that as many persons are continuing to work as possible, or many persons can be returned to work so the economy can continue to turn over. And so in that case, I would say that that is the rationale. And my thing is that I will work with anyone and be as flexible as possible as long as there's a way to get more and more persons back to work. And I think we've proven that by not only having personal services, limited personal service in phase 2, moving some things out of phase 3 to phase 2, some things out of phase 4 into phase 3, while making sure that we manage the risk to try to get as many persons back to work as possible. I made some comments in my press conference on Thursday when speaking about persons' perceived disparity between restaurants who are able to have indoor facilities and bars alone, which do not have indoor facilities and cannot have patrons indoor facilities. And I've said that the Attorney General is looking at the changes to the particular Liquor License Act, or a way to allow for the possible construction of external facilities for these particular establishments. Even restaurants are not allowed to have persons at their bars, even though they may have a restaurant license. They're only allowed to serve people who are sitting at tables, whether they are with the limited seating indoors or with the outdoor seating, which is still subject to social distancing requirements. But on the overall thing, we want to get as many persons back to work as quickly as possible. And I would say that that is the rationale for that particular decision. And one of the things I've learned in politics and leadership is that oftentimes people will not agree with the decisions of which you make. But as long as you are practicing a certain principle in the decision-making process, then I think that people will accept the decisions of which you're trying to make. And the principle in the government of Bermuda and its actions is trying to get as many persons back to work to continue to increase economic activity in our country in a safe way as possible. And certainly outdoor seating in a restaurant is far preferable to indoor seating in a restaurant, as outdoor there is restrictions of transmission or limited transmission. There's a question that says here, will the Department of Health put a focus on health and nutrition? I think the Department of Health has done an excellent focus on health and nutrition further, but if you think that there is more of a focus on health and nutrition that is necessary, then I'm certain to relay that. I think that it's particularly important, and I know that the Minister of Health has spoken about in previous press conferences, the importance of eating well, making sure you remain fit, and making sure you do what's necessary in order to boost your immune system in order to be able to fight off infections, whether that's the coronavirus or whether that's any other type of infection. And I think that it's particularly important that persons focus on that. The coronavirus affects those persons who are immunocompromised, which means they have compromised immune systems. It also affects persons who may have compromised lungs. That means persons who may smoke. And that is something that will lead to additional challenges there. So I think that on the overall perspective, I think the Ministry of Health has made those messages clear. And I would reiterate to all persons who are watching to make sure that they are eating well, are taking care of themselves, are certainly exercising, outside, going for the walk with your family and doing those type of things to make sure that their immune system remains strong. Health IQ Bermuda is seeing a continued increase of potential cases. Are these people being tested? And if yes, is the system being updated when they're negative? Health IQ is not going to Health IQ is not linked to the testing system in any way. Health IQ is more of a population I don't want to say a reporting tool so persons can see. If persons are going health IQ and they do the type of questionnaires which says they're a probable case, those persons are certainly, because it's anonymous, those persons are recommended to go ahead and get tested. And those persons may likely go ahead and get tested. But health IQ, the submission on health IQ are anonymous. You are not required to go ahead and enter in your phone number. That has been taken off. So it will be difficult for us to go ahead and follow up. But if someone does submit answers to the questionnaire, which would say that they are a probable case, information is certainly given to direct those persons in order to get tested. I am not surprised, and I want to make sure this is clear, that persons who are reporting their symptoms on health IQ, and we may have been seeing, and as you would say, an increase of probable cases. We have opened up the economy faster than some of other places that are comparable to Bermuda. And I want us to be clear that the only way that we will be successful in this strategy as a country is if we wear our masks, maintain our social distancing, and do the things which are necessary. Hate to sound like a broken record, but just look at a country like Taiwan. Universal masking, very few cases. Massive population, very close to China, massive public transport systems, etc. However, they are able to do it because they continue to maintain that hygiene. That is key and that is critical, and that's what has to be reminded for persons. It is very bad, and I made a comment because someone was very upset on my Twitter account about how the fact that we can't have a raft up and why is it the restriction of this amount of people? Just because the total amount of persons that are allowed to be in a group where it's not unlawful is 20 persons, I wouldn't advise anyone, unless it is absolutely necessary, to be in a group with that many people. It doesn't make sense unless you have to be. There is still a global pandemic. And so while we are balancing, trying to give people a little bit of freedom versus other things, people must be wise, people must be smart, and people have to take care of themselves, because if you don't take care of yourselves, you will put your family at risk. There's a question here, will there be a program or a broadcast about Mary Prince on Mary Prince Day? I'm sure there'll be more than a program and a broadcast. So absolutely, as I had mentioned earlier, the governor of Bermuda will make sure that this holiday is very appropriately, the first Mary Prince Day in Bermuda will be appropriately recognized. There's a question, what are the monitoring regulations for Airbnb visitors? What are the expectations for owners? The expectations for owners will be similar to the expectations for hoteliers, and those will be relayed. They're not going to be that significant, I would say. I want to make sure that persons are able that we are keeping our the biosphere of the country safe. So I think that it's particularly important that those regulations be adhered to. But we certainly want to encourage tourists who are safe. And I think it's important to know that it's a bad assumption that if a plane comes from Bermuda, that everyone on the plane is going to be infected by the coronavirus. And a perfect example is the second Airbridge flight, which came from the UK after testing, there were no people that were positive on that flight. And so it's an important thing that we understand and recognize that it is not always, persons will not always be positive. And so it's always you take it on a risk basis. Oh boy, forgive me. It is like children's bedtime. Don't watch yourself. Don't fall on that. Oh no, you almost tripped the lamp down. Good night. You said night to everyone?
Good night.
You said night? You have to go so they can see you. You have to look in there.
Night.
And tonight?
Night.
Do you want to tell everyone we did today? Where do you go?
We went on a ferry.
It was lovely, wasn't it? Yes. And did you wear your mask when you were inside?
Yes.
All right. Good job. Night, Em.
Night, night.
Go to bed. Yes. Love you. All right. Go ahead. You're out, mister. Yeah, don't trip over that thing. All right. See you later. Nia's very excited because I think she's trying to go to Sunday school tomorrow because church is back open. So that should be fun. All right. Will there be any enforcement of the Ministry of Health rules and regulations for summer camps? Absolutely, there will be enforcement. And I don't want to be like the big bad wolf and trying to shut things down. But if we don't do things right and proper, we're certainly going to have a problem. So it is going to be necessary for persons to make sure they follow the rules. And we have to take a very hard line on enforcement. I do know that there's a few daycares that were concerned with the level of regulation that was there. Those were regulations for phase 2. I do know that those regulations have been relaxed a little bit to be more realistic for phase 3. I'm pleased that I understand that my son's nursery school is going to be reopening next week. Certainly relief here for that. But we have to make sure that we continue to remain vigilant. And I want to make sure that all of the providers who are certainly going to be able to go back to work in these particular cases and instances are abiding by the rules. There was a question here that says, can you explain phase 3B? There's a person that says, can you explain phase 3B? I certainly can explain phase 3B because there's been a whole lot of things which have been said about this. And I just want to say that this is not new. So we've had these phases before where we have done some intermediate changes. I mean, we didn't call it a phase 2B, but we did make some changes in the middle of phase 2. It was just something that was given to say that there may be some additional changes before we moved officially to the next phase. And so that's really all it is. So even in phase 1 or even in shelter in place, we opened up to some pet stores and hardware stores in the second half. We went into phase 1, a few expansions, phase 2 as well. That's all that this is, that there may be some more modifications which are made to what exists. And those particular modifications, I think, are something dealing with commercial boats, making sure we lay out the specific requirements there. I think there was also a change and relaxation, as I said previously, on the issues of additional personal services subject to additional testing. So I think those are the only changes which I think are part of the things which have been communicated to me from Colonel Birch, who's chairing that particular committee. Just checking, just to make sure. Yep, those were the two particular items. It says, can clubs, bars utilize outdoor space if they have it? That's the other thing for phase 3B, which I had said that the Attorney General is working for. The answer to the question is it's a difficult one. The short answer is we're going to make sure that this is possible. And it's a very strange thing because there's different types of liquor licenses. So club and nightclub licenses are different than bar and restaurant licenses. And these are things which are particularly difficult. The fact is that just to answer this question, it says, can clubs or bars utilize outdoor space if they haven't? If you have an outdoor bar that exists, you're allowed to use it. And I know there are places that have outdoor bars that have used their outdoor bars and have gone ahead. And that was allowed, I think, in phase 2. So that's not something necessarily for phase 3. The question is for places that have indoor bars and want to be able to use their outside spaces, that was something that was a little bit more challenging. But the Attorney General has assured me that we will work out the rules to make sure that can happen. And I think that that's something that we will be able to confirm by next week, Thursday. I am very cognizant of what persons will perceive as a level of discrepancy between bars and restaurants and how those things are. But what we have to also note and recognize that our bars, how they are set up, and pure bars are not established like a restaurant with table service, with waiters, where there's minimal interaction, there's minimal persons that are gathered around. And we have to strike the right balance between restricting interaction and activity, which can lead to increased transmission. So it is a challenge that we're looking at addressing. The Attorney General on Thursday said that she was working through that particular issue, and I would hope that we'll have specifics on that at our Tuesday press conference. I do recognize the challenges of which this does present, but what I want to make sure is that we are making sure that we're keeping our country safe and recognizing without question, I like a drink as much as others, that when you are inside of that particular environment, your guard is not as up as it would be. And we don't want to create a space where there can be additional transmission of the virus. We just have to make sure that we are very, 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 very clear. But the question here, as long as they're inside like restaurants, as long as they adhere to social distancing table service, that may be a requirement of which we're going to lay out, but that will be confirmed on Tuesday. There's a question, when will we be able to gather 50 or more people? I can't tell you that. And I don't know specifically whether or not phase 4 that there will be an increase in the max gathering of persons allowance, to be completely honest. We need to continue to be vigilant. And so I can't necessarily speak to when that may or may not take place. That's the best answer that I can give there. This is a tough one. When can families visit rest homes? I know that there'll be a number of persons who haven't been able to visit their loved ones that are in our resting homes, and that's something that is certainly a challenge. We do know that rest homes are one of the places where there can be a particular risk. We have certainly seen our challenges here in Bermuda due to that with sickness and some persons who have lost their lives. And we want to make sure that we are as careful as possible. So on the issues of families visiting rest homes, on the issues of persons who are, on the issue of persons who are, I would say, work at nursing homes or rest homes and want to work at multiple resting homes, those are not considerations, decisions which have been made right now. But we're going to make those decisions as soon as it's possible and safe to do so, certainly on the visiting of resting homes. And that might be something that may come into conjunction with the antigen testing for in the same basis of the hospital. But right now, I don't foresee that as something that's going to happen in the very, very near future. It's certainly something that we want to address because, of course, talking to someone via an iPad or through WhatsApp video, it's not the same as being there close and next to someone. So we recognize that that's certainly a challenge. Has there been a decision on freezing posts if posts become vacant or whatever reason or overtime, et cetera, in government? Absolutely. That's part of the agreement that the government is trying to finalize with the unions. But the Minister of Finance announced that vacant posts have been frozen. And we are only filling vacant posts which are necessary to fill. So I think that there's been a number of vacant posts and there's a significant amount of money there. And the only ones which are being approved are those that are dealing with the particular issue which we're dealing with right now, which is health. So for community nurses and those type of issues, those are matters which will be filled, but certainly not any others. And so we're going to have to continue to do what the government has been doing for a very long time. The government has not been fully staffed for about, I want to say, 12 to 13 years. The government has been running on reduced staffing since about 2009 in many particular cases and instances. The head count is down significantly, and the head count continues to be down significantly. And we're going to continue to work through those particular challenges. So the answer to your question is yes. When will, that's fine, 15 minutes. I'm gonna have 50 minutes. Mm-hmm. I was saying that.
I don't have to, okay.
Sorry, there was just a whole lot of questions which are coming in, so I was just communicating. We had a minor technical difficulty. We're having an issue printing things. At the beginning, we were printing out of time very soon. You don't have to keep writing questions. That was next. The next question I've been advised, I've been bossed to say is, will we have a curfew in phase 4? I don't have an answer to that particular question if we'll have a curfew in phase 4. I do not think that we'll have a curfew when we leave the state of emergency. And the target for the entry to phase 4 is the exiting of the state of emergency, which is June 30th. But we'll have to see what the conditions on the ground are at the time. And so I would say for all those persons who do not want a curfew in phase 4, don't tear it in phase 3. Just don't, just stay home. It's not that deep. The summer is long enough. If you're not out on the water, you don't have a raft up, you will be okay. I promise you, you will be okay. This virus has given us time to reconnect with our families, a lot of time to reconnect with things that we didn't use, that we forgot how to do. This virus has given us time to, enhance our skills, do more reading, increase our knowledge, become more conscious, become more aware. And I think that that's what's particularly important. And so I cannot express enough that there is still a pandemic which is going on. And that relates to another question which came in, which says, when will shielded people be able to leave their homes? I hate to say never, but as long as the virus is still circulating in our country, which it is, I think that you must be very, very cautious as to if you are someone with severe risk as to, when you may leave your homes as a shielded person. But I don't think that means you should stay inside. As long as you are not putting yourself in a position where you may contract a virus, then you're fine. So if you're a shielded person and you're going on a walk on a secluded beach, or you're going on a walk with places where there's not a lot of persons, then you're fine. You don't need to remain indoors. What I would not recommend is that you go to a place where there'll be people who will not be wearing masks. And so if you're going to the grocery store, that's a place where there's hand hygiene, there's people that are wearing masks, there's all the rest, and other places where that much is happening. But I would restrict indoors. Certainly as a shielded person, I wouldn't go anywhere where there are persons who may not be wearing masks, which will put you at risk. Okay. There's a question of, can taxis be fitted with plexiglass? I think that some have. I would say on that particular basis, certainly taxi drivers must make sure that they are doing what is necessary in order to keep themselves safe. And the best way for taxi drivers to keep themselves safe is to certainly follow the guidance of which was issued on the coronavirus.gov.bm website, and ensure that anyone that is getting inside their vehicle is wearing a mask, is maintaining a mask, spray hand sanitizer on there beforehand, and making sure you keep up just the basic hygiene principles. If those persons are wearing masks, you're fine. And I've seen some taxi drivers driving around not wearing masks. I would never get into a vehicle with someone who's not from my household who was not wearing a mask. And it's just not wise to do that, especially if you have on the AC. It is in an enclosed space. That is a space of risk. With asymptomatic transmission, you don't know. So it's important that we continue to educate ourselves on how the virus is transmitted and what is necessary in order to keep ourselves safe. Can consideration be given to early retirement for public servants on time served instead of age, for instance, 30 years or more? That's a great question. The answer to the question is yes, consideration can be given. I know that we are looking on the paradigms of reintroducing the voluntary early retirement incentive program. That was one of the things of which we discussed, and that is something that will come into place. But you're not the first person to ask that question. I think the law now says that you're ineligible to pension until a certain age, but it might be tricky. And the reason why it might be tricky is because the government pension is a defined benefit pension. And if you are eligible for your pension at a younger age, that means that you'll collect it for a longer time. And that means that it will throw the system out of whack. So I think I just answered my own question. That might be difficult in order to do that. And that's the reason why that defined pension plan, that defined benefit pension plan is set at certain ages of eligibility. Is there any update on the suspension of pension contributions? I'm not sure if that's in government or in the private sector. What I can say from an issue of the private sector, that bill was tabled in Parliament last Friday, will be debated in Parliament this Friday, in addition to the suspension of social insurance contributions, which will be debated in the House this upcoming Friday, which will then go into the Senate. And the timeline to put that into effect is July 1st. And I certainly think that we will meet that particular timeline. Trying to make sure we get through all these questions. Here's another page. Questions. Prior to approving work permits for non-Bermudians healthcare professionals, will Bermudians already in private tax be taken into account? Absolutely. And please apply for the positions if they exist. The Minister of Labor will be attending the press conference on Tuesday to speak more about these particular issues. I'm actually going to encourage Minister of Labor to possibly do the Facebook Live next week to make sure he's able to answer questions and give certain interactions on the myriad of issues of which he's tackling after being on the job for the last, I want to say 11 days. But certainly, I'm very, very disturbed by employers who may be bringing back their non-Bermudian employees and leaving Bermudian employees to collect unemployment benefits. But you know what's also disturbing? What's also disturbing is reports which I heard while talking to a business owner that he has offered staff to come back to work, and they have refused to go back to work and said they would rather just collect the unemployment benefit. I made that situation clear to the Minister of Labor. And if you have been offered to go back to work and you do not choose to do so, you will probably cease to be eligible for your unemployment benefit. And that's probably something that will have to be clarified very shortly. We all have to play our part. And it's great when I see persons who, don't want to collect unemployment to make sure that they are saving it for people who need it, or persons who want to give back their social insurance to make sure that persons who need the money can get the money. But if you have been offered to come back to work and you decide not to, I think that you are, stealing from your fellow citizens. And I think that it is a responsibility of you to go back to work and to do what is necessary to provide for you and to provide for your families. And so for those persons who may be watching who are in that boat, please make sure when your employer calls you back to work, you go back to work. And if you are not getting full salary, the unemployment benefit can be adjusted, as was said, but please make sure you go back to work. How long should people be able to work from home now that the mandatory work from home has ended? Mandatory work from home has ended. That will be up to your employer. I know in the public sector, there's been a number of persons who are still continuing to work from home. In the private sector, I know that's the case as well. Mandatory work from home has ended, but we certainly want to ensure that persons who can work from home continue to work from home, and this will be up to the individual businesses. Is there any update on the ratio for nursery schools? Many are working at half capacity. The Minister of Health has said the ratio for nursery schools will be the same ratio that was in the existing regulations prior to the coronavirus taking place, however, with enhanced cleaning protocols. And I think that that has been communicated to nursery schools specifically. So I know that there's enhanced protocols that are there, but regarding the capacity issues on the nursery side, I think it'll be the same requirements as is spelled out inside of the regulations, the daycare regulations, which existed prior to the coronavirus. There's a whole lot of questions about this, and I've seen a lot. And it says, why are we giving special permits for a crowd of 7,000 last week? And today at Bars Park, we're still restricted to 20 persons gathering as a funeral, etc. The law states that the Minister of National Security can grant a permit for an assembly that is in excess of 20 persons. This law change is made for two particular reasons. Number one, because the unions have requested in order to facilitate their meetings to vote on the request which has come from the government. They've identified a space that is large enough to hold not all of their union members at once, just to be clear, but to rotate persons through in order to have those meetings. The second issue was in regards to a protest, which the government was aware was going to take place last week, Sunday. Governments have, and nothing in this job is ever easy, but governments have to weigh all of the possibilities and to come up with the best decision and answer. In that particular case, in that particular instance, we had two options. The one option was that we could have said, no, there cannot be a protest, and sent the police out there to enforce that rule. And I'm not entirely certain that that would have been the right decision, because I have seen and been around a place where there was protests that were going on and taking place. Granted, it wasn't a pandemic. December 2nd, 2016, and the powers that be on that particular day said, we're going to send the police in because we're going to want to do this and we're going to make sure that we enforce this. That's not the right decision. I disagree with it then. And I had to find out what was the best way in order to make sure that we can keep this safe and not cause a space where, knowing that there's going to be assembly, where there's going to be a protest against global police brutality, to put my police in trying to enforce so persons are not protesting. That did not make sense. And so the government decided that we would change the law to enable us to give a permit for a protest. But here's the thing. Here's what's different than persons assembling at a house or assembling at the beach and all the rest. Any of those things which are granted those permissions are policed by the police. So just as there was on the march last Sunday, or just there was the March day, of which there were far lower numbers, and people were required to wear masks, required to practice social distancing, and the police were there ensuring that the rules and the laws were enforced. That's why it's different than a situation in your house. That's why it's different than, a massive raft up, which people might be wanting to have in the water. That's why it's different. It's a question of enforcement and making sure that we are not making it impossible for enforcement of the rules to take place. So it's been a question that's been asked for a lot of times, but as leaders, you have to often make, as I say, the least bad decision of two bad decisions. In this case, I think that we made the correct decision in permitting the march to take place. And the vast majority, I want to say 99% of the people who were at that march wore their masks and kept their masks on. And I think that will certainly minimize any possible transmission of viruses which may take place from that. Oh, no question. Question, will taxi drivers be getting some relief from payroll tax? I would say that's a possibility, certainly. And the Minister of Finance is knowing that he's had to turn his attention to other particular bodies of inside of the Bermuda economy. So certainly I know the minister's live to a number of issues. I will say that the single largest group of persons who are collecting unemployment benefit are certainly not largest, but percentage wise, are taxi drivers. But our taxi drivers are the backbone of our tourism industry, and we want to make sure that they are taken care of. And so while there is still some movement, while people are going back to offices, while people are now, going back to restaurants and other things and eating out, but we do know that more taxi drivers are going back to work. With the lack of a tourist season and certainly the lack of a cruise ship season, we know it's going to be very difficult for them. And so I think that that type of relief possibly makes sense, and it's certainly something that we will explore. Am I concerned about an uptick in cases after last Sunday's peaceful protests? Two things. I do not believe that the two are related. I believe that after last Sunday, any test results that will come in, I think it might be too soon for those things to manifest, and we typically have to wait until about 2 weeks' time. So no, I'm not concerned about it in related to the protests. I am concerned about an uptick in cases, because I think an uptick in cases is not related to a protest or related to phasing. I think it's related to people letting their guard down. And so that's what concerns me. So we need to be very, very good at keeping our guard up. And so that's what I will certainly say. The question regarding overseas mail, I have an official answer. No mail from the US and Canada currently, expecting mail from the UK, and I think those are on the airbridge flights. We have received mail from other countries, but as the mail starts back up again, there certainly will be, as the flights start up again, there certainly will be ability for mail to return. Okay, I think we're about to wind down. Let me finish this last page of questions. I know that we're going a little past. It says, when will the saliva test be available? Dr. Karika Weldon has confirmed to me that the verification of those saliva tests has been completed. We're going to be ordering supplies in order to be able to process those tests, and it's the expectation that we'll be able to offer them, I would say, when the borders reopen. So the target date for that is July 1st. It may be sooner, but the target date for that is certainly July 1st. All right, and I think that is questions of which I have gotten to. I know that there are a number of other questions which have been asked. If I did not get to your question, I do apologize. Here's one. There's a number of questions regarding boats, and I'm going to close with that. Number one, okay. There's a question from Ms. Trim, which says, what is the point of a curfew? I think that I have explained that to minimize the risk of transmission. Yes, transmission can happen in the day and transmission can happen in the night, but this is about the minimization of the opportunities for transmission. The fact is that when businesses are closed at 10 and forced to close at 10, the businesses which are not open late, it makes sense for us to, I would say, limit and restrict gatherings after that time to reduce the possibility of transmission of the virus. There's a question about, the status of boat use, raft ups. I know there's a whole lot of questions on raft ups, why we can't have raft ups, et cetera. It goes back to the question of enforcement. It goes back to the question of multiple mixing of multiple households and more mixing multiple households, which may taking place, and the possibility for super spreading events. And that's the reason why these particular things are not permitted. Believe me, I love a good boat day and a good raft up just as much as anyone else. But right now is just not the right time. And we have to remain vigilant on these things. I know that everyone was really excited that we went 10 days without a new case and persons let their guard down. That is not the correct approach to take. If we look at the successful countries, they have not let their guard down, and they have been successful because they continue to wear their masks on a regular basis with regular masks. And so that's the same thing that I will continue to encourage persons here in Bermuda. Final question along the lines of boats. It says, does anyone know if the gathering of 20 persons includes boats as well? Absolutely. That provision applies across the board. However, social distancing applies as well. So please don't put 20 people on a punt. That's not the way to go. And as I have said before, please, if you don't have to, don't. I mean, if we can go a year without cup match, you can go a few more weeks without having a massive boat party. I'm certain you can. And I think that's the language and the lesson. We have a new normal for a reason, that there is a highly infectious virus and the worst global pandemic in 100 years, which has claimed the lives of hundreds of thousands of persons around the world and has infected millions throughout the world. And so we have to continue to be wise about this and making sure that we are keeping our guard about us. So with that, I know that I started a little bit late and I'm ending a little bit late, but I want to thank everyone for their time and attention. I want to thank everyone for their continued vigilance. I want to thank people for their continued words of support and also for their continued constructive criticism. Government is, as we are proud to live in a democracy, and government is only as good as the persons who provide that particular input. So I want to end by giving thanks to my entire Progressive Labor Party caucus, who continues to keep us in line. Certainly our cabinet colleagues, my cabinet colleagues, who are continuing to work in week in, week out. All members of the legislature who continue to participate in our democracy, even those ones in the opposition of whom we continue to work closely with during this particular time, and all of our frontline workers and all of the persons who are there making sure our government services can continue to be delivered and continue to be delivered well. Bermuda does have a success story, but our success story can turn into an unsuccessful story very quickly if we let our guard down. So if there's one thing you take from this presentation tonight, when you see someone not wearing their mask next to you, tell them to put their mask on. That is the only way that we are going to be able to continue to be successful in our fight against the coronavirus. So with that, I would like to say thank you and good night to all. Take care.